On. Hello, welcome to our cupping demonstration. We're going to try our trial period for our lab practice with some basic cups that are most commonly used in the clinic. Easy suction cups made out of silicone. These are very easy to clean and easy to use, and as you use them more, they soften up to make it even easier to be more pliable. Now make sure you have cleaned and dried the patient's skin before you get started. And make sure that there are no open wounds or broken skin. So if you see an area that has any rashes or skin irritation, we'll avoid those areas. We're going to stick to the areas that don't have any unbroken skin. Now begin by using some lotion. I prefer to use oil, such as a coconut oil, and distribute the lubricant over the skin so that you can get a better seal between the cup and the skin. We're looking to achieve a certain degree of suction so that we can get some adherency between the cup and the skin. So I like to spread my lubricant liberally over that area, and then of course having the greasy fingers means you might want to just have a towel handy and wipe off before you begin grasping the cups. Otherwise it gets to be a little bit too slippery. So choose a cup based on the size of the body part you're working on, and also based on how much suction you want to achieve. As we discussed earlier, the larger cups actually generate greater suction effect because you can push more air out and then it'll suck up the skin and fascia right into the cup with more pressure. The smaller cups work on a smaller area, and also if you wanted a finer or lower degree of pressure. We're just going to start with the smaller cup. I like to lube up the cup rim a little bit, and I love these nice smooth rims that are on the cups because they're very comfortable for the skin and they provide an optimal gliding effect when you're using the gliding cup therapy. So to begin with your clean cup, squeeze the air out, select the area of tension. Say if someone had excess lumbar lordosis in their back and you wanted to do some biomechanical correction of their posture, you want to reduce the lordosis by opening up the fascia in the lumbodorsal region. So squeeze the cup, place it on the body, let it come down to a round circle, and if you look inside, you can see the skin balled up, lifted up a little bit, kind of like a nice hamburger bun. So we have a delicious hamburger bun, and if you pull, you can check different directions: superior, inferior, lateral, and medial. Superior, lateral, inferior, medial, different angles around an imaginary clock. This will give you a perception of what direction the tissue is tightest. I have a little more resistance to my superior glide and a little bit more bounciness to my inferior glide. Laterally, less mobility, a little more abrupt end feel, a more abrupt to the stop of motion. Medially, a little bit more bouncy, a little bit of a softer end feel. So that gave you some information about which direction it's tight. Now if you look closely here, you'll see that immediately the blood flow has come up to the skin and the area starts to turn darker. Usually it goes from a pink to a red, and if we left the cups in place for a few minutes, it would actually become an ecchymosis or purple because you have the superficial capillaries then leaking some of the blood into the tissue. So there's no harm done in that effect. That mark tends to stay for a couple days to a week. In most people, depending on the person's ethnic background, you may have a more or less obvious shift in color depending upon their skin type. And the color does shift across all skin types. So, make sure you have good lighting and you could observe. As you see here, we haven't had the cup here for more than a few seconds, so the pink sensation is going away already. I like to use the cups as a gliding and moving myofascial release therapy. So if this person had exaggerated lumbar lordosis, you could see that on skin rolling, and remember this is just our model so he doesn't have that problem. With skin rolling you could lift the skin, and he has some very nice mobility here. You could try the rolling in different directions. When you feel that it's very adherent, that's telling you, hey, I'm having trouble gripping this area. How can I get a better grip? The cups are the perfect answer. So grab your cup, release the air by pressing, squeezing, place your cup, and now you'll have a moving cup. Now this is pretty tight. How does that feel, Edward?
It feels okay.
Not too tight?
No.
So as you lift, you get a stretch in the skin, And you see that this one is popping off. What does that tell you? We need a little bit more lubricant. I prefer coconut oil because it's solid at room temperature, but then as you warm it up in your hand, it turns to a liquid. So it's nice because it doesn't spill all over the clinic when you drop it. And it's also nice because it's very thick and dense and viscous. So lubricate the cup rim, lubricate the patient's body where you want to work, squeeze the air out of the cup, and then you could start your gliding massage. So glide in different directions, seeing which direction is tight or provides resistance or a barrier to movement. In this case, it's actually the inferior glide is a little bit more stiff there. If you come into an area where there is a space or depression in the skin, often the air will seep in and the cup will dislodge. Simply re-squeeze, replace, and move on with your cupping massage. Now I could do some strokes coming transverse to the muscles, which are longitudinally oriented in the lumbar spine, or I could move longitudinal in the direction of the muscle fibers. So you picture the tissue that you're working on when you're working with the gliding cups. And as I'm coming back and forth, I can see that the circulation is increasing in the area. There's a warming sensation. Can you feel that warming sensation?
Yes, I can.
As the blood flow comes in, take extra caution if you have areas where there's body hair, which is natural on pretty much everybody. More lubricant will keep you from becoming a depilatory for the patient. If you don't want to rip anybody's hair out, I do not advise using shaving prior to cupping. Why is this so? Why is this not advised? Well, when people shave their hair, the skin may look normal, but because of the scraping of the razor, sometimes there's micro tears in the skin, or sometimes you could even see these little red bumps. And in that sense, you might end up actually having some open areas of the tissue. Now, that increases the chance for infection. So we don't want to use this over any freshly shaven skin. I usually ask patients to wait a day or two before using the cupping if they've been shaving, because we want to keep it sanitary, and of course infection control is always the priority. To try a bigger cup if I want to work on a larger area or gain more suction, the more you work with the cup, the softer it is to hold. And if the cup's warmed up slightly, I might put it on top of a towel on top of my hot pack machine, so it's warmed up slightly. It becomes easier to work with. It's more pliable. So squeeze the air out, place the cup, and now you see, because I made a very light squeeze, we have a very light suction. And I could massage through. Do you feel it's more comfortable in any particular direction, going down or up? Does one feel better than the other?
I think up.
Up feels better, because he's tighter going down, so that's where he'll feel a little bit more tension. Some people like to turn the cups, which allows them to glide more easily. But again, we're using this often as a warm-up prior to other deeper tissue mobilization, to bring blood flow to the area, and to start to get some mobilization of the fascia for improved functional mobility. So we have different style cups. Again, start with the medium size. A small squeeze will give you a small amount of suction. If you do a greater squeeze, get all the air out of the cup, and then place it, you'll have a much stronger suction. Feel the difference?
Mm-hmm.
And if I wanted to work on a scar to separate the layers of skin, I could actually just pull on the cup directly, in this case posteriorly, to get some stretch. Again, I don't want to leave the cups in place for too long. For this particular skin mobilization and scar mobilization, a few minutes is often too much, and it'll start to get you that purple mark. So the gliding and moving, test a small area on the body first, see how the patient's skin responds. Do not assume that because they are a certain ethnic background or skin type that they're going to have a certain response. You need to test. So do a short period of time, maybe 10, 20, 30 seconds, see how the skin responds, and then you could go from there. I'll often take a photograph of the area before and after the treatment so that I know for different periods of time how much ecchymosis or redness that I would expect to see. Now there's different types of cups. We'll be going over those in one of our future videos.